Hello everyone, welcome to the Swayam online course. I am Dr. Rajkala Panchakshari Patil, Associate Professor and Head, Department of Panchakarma, Faculty of Ayurveda, Institute of Medical Sciences, Banaras Hindu University, Varanasi. In this module, that is 7th, that the module is based on the Nasya and Raktamokshana, and the today's lecture will be on the applications of Raktamokshana. As in previous module, we discussed about the Nasya procedure, Nasya types and clinical application of Nasya. Even though the basics of Raktamokshana and types of Raktamokshana also we finished. So in this lecture, whole lecture will be consist of the procedure of leech therapy, material methods required or preparation of the leech therapy, indications and contraindications of leech therapy, and complications of Raktamokshana and applies of whole Raktamokshana, that is clinical application of Raktamokshana. So coming to the first procedure, that is leech therapy or Jaloka Vacharana. So what is Jaloka? Jalam asam ayu iti jalayukaha. Jalam asam okaha iti jalokaha. Jalokasaha. So what is Jaloka therapy? It refers to the medicinal use of leeches, and the word Jaloka means produced in water. That is Jalam asam ayu, or who creature that lives only in the water, that is called the Jalokasaha. And this creature have a unique natural ability to draw out impure blood from diseased part of the body. That is a special quality this Jaloka is having. They take only impure blood, not the pure blood. So what is the importance of Jaloka? Due to their cold and soothing nature, they are specially effective in treating conditions caused by the Pitta dosha and are suitable for the sensitive individuals. This is only the importance of Jaloka, that it has the Shita property and it can be used in the delicate person. This is what makes the Jaloka more important in Raktamokshana. It is specially used in special condition, like if you need to remove the impure blood from small quantity in area where you cannot go for the Raktamokshana or Siravedha, there Jaloka can be used, or in the kids. So this therapy has been practiced since ancient times and remain important even today also. Like since in Ayurveda, it has been explained since long ago. Nowadays also in many sciences or in many pathies, it is being practiced. But in Ayurveda, because of its ancient explanation, that you will see, like they already mentioned what are the Savish Jaloka, what are the Nirvish Jaloka, what are the types of Jalika, and even though classification with explanation they have mentioned. So there are two types of Jalokas or leeches, that is Savish Jaloka and Nirvish Jaloka, which is explained in the Sushru Samhita. So he mentioned that how the Savish Jaloka is. So Savishaha tasu anjana churna varna pruthu shiraha krishnaha varmi matsya vadayataha chinna unnata kukshihi karburaha romasha mahaparshva krishnamukhi alagarda indrayudha ऊर्ध्वराजिभिश्चित्रा इंद्रायुधाः इसत शीतपीतिका विचित्र पुष्पा आकृति चित्रा सामुद्रिकाः. He explained the each, like how the Savish Jaloka, which each Jaloka explanation he has mentioned. So that means this science was in a full-fledged or more, that time it was more practiced in that area. Govrushanvat adhobhage द्विधा आकृति अनुमुखी गो चंदना इति ताभि दृष्टे पुरुषे दंशे श्वयथु अतिमात्रम कंडु मूर्छा ज्वरो दाह छर्दि मदाह सदनम इति लिंगानि भवन्ति. If this Savish Jaloka we used for the Raktamokshana, or if bite the person, they may have the shvayathu atimatram, severe itching, murcha, jwara, daha, that is mada, sadanam. These all are the features of Savish Jaloka dansha. Tatra mahagadaha pana आलेपन नस्य karmadishu upayojyaha. So this is what if they bite the person, so they have to use mahagada or the disease or the medicines which is told in the toxicology or in Agada Tantra, that is for pana, alepana and nasya, that all has to do. So this is explained, this explanation is from the Sushruta Samhita. So that's why since that time this Jaloka is used in Ayurvedic treatment. So these are the names of the Savi Jaloka: Krishna, Karbura, Alagarda, Indrayudha, Samudrika, Gochandana. And coming to the Nirvish Jaloka. So this again 6 Nirvish Jaloka has mentioned by Sushruta, Acharya Sushruta, like Tatra Manashila Ranjita Bhyamiva Pashwabhyam Prushthe Snigdha Mugdha Kapila. So Kapila, this is all the explanation of Kapila. It should be Manashila Ranjitabhyam, the color should be like Manashila. Pashwabhyam Prushthe Snigdha Mudgavarna Kinchit Rakta Vruttakaya Pinga Ashuga cha Pingala. This is the explanation of Pingala, how the Pingala will be. Yakrutvarna Shigrapayini Dirgha Tikshnamukhi Shankumukhi. This is the explanation of Shankumukhi. Mushika Krutivarna Anishtagandha cha Mushika. This is the Mushika. Mudgavarna Pundarika Tulya Vaktra Pundarika Mukhi. As per their mouth, they have explained the different names. Snigdha Padma Patravarna Ashtadashangula Pramana. So this is the length of the Savarika will be Ashtadashangul, 18 angul. Sacha Parshvarthe Ityesha Avishay Vakhyata. These are the non-poisonous Jalokas like Kapila, Pingala, Shankhamukhi, Mushika, Pundarikmukhi, Savarika. So classical indications of leech therapies are the diseases like Vidradi, like abscess, Visarpa, erysipelas, Arsha, hemorrhoids, Tvakvikara, skin diseases, Granthi, cyst or granular swelling, Shotha, inflammation, Raktadushti, impure or vitiated bloods. And nowadays, like we use it in many diseases also, okay, like where this not any treatment can be done or can be useful, but Jaloka will give the, like in pylorrhea, when there is abscess in gums, or if there is swelling, if there is wound which is not non-healing ulcers, if there is infection but that is not resolving, if there is cyst that is infectious, so the Jaloka will take this all impure blood. So that is what is very effective. In some individuals, like in women, children, elderly or delicate or sensitive person, where we cannot go for the any panchakarma or where we cannot go for the Siravedha, their Jaloka will work. The contraindications of leech therapy in hemophilia, pregnancy and anemia. It is also contraindicated, so it should not be done. So procedure of Jaloka Vacharana. First is the preparation or keeping or taking care of the Jaloka. Atha enam nave mahati ghate saraha tadaga udaka pankam avapya nidadhyat bhaksharthe cha asam upaharet shaivalam valluram audakascha Kandash Churni Krutya. So the leech collection, what is told by Acharya Sushruta, it should be collected during the autumn season and it should be placed in a large vessel, Nave Mahati Ghate, with water and pond mud. And for the nourishment of these plants, aquatic vegetation such as algae, water plants and powder waterborne tubers should be provided to them for the nutrition. Then what it is beautifully he has mentioned how to take care of the Jaloka. Shayyartham, for their sleep. Trunam odakani cha patrani, like for the bedding provide the aquatic grasses and leaves. Traiha cha abhyo ajjalam bhaksham cha dvayat. Bhaksham cha dadyat. Every 3 days they should give the food should be provided or replace the water. Saptaratra cha ghatam anyam sankramayet. So after 7 days they transfer the Jaloka to the different vessel. Previously the mud pots they were using, no? So after 7 days you have to change the pot also, or you have to change the water should be changed after every 3 days. So leech purification. So the leeches which are intended to use are placed in the kidney tray filled with water and we put 1 teaspoon of the turmeric powder, and they allow the leeches to remain until they are purified and becomes more active. Once you put the turmeric powder, they become the more active and they start running in that water. So once the leeches become agile, they are ready for the bloodletting therapy. So patient examination and preparation. Before starting leech therapy, confirm the patient's suitability by checking the bleeding time, clotting time and blood pressure. As the Jaloka is having the hirudin, it tend to bleed for more time. That's why we have to check the BT and CT. For the first 3 days, give the patient we usually give the small amount of, that is 30 to 50 ml of medicated ghee or murchit ghee internally for Snehapana. On the 4th day, usually perform the full body Abhyanga and Svedana followed by Svedana. Precaution before leech therapy, hemoglobin level must be tested. If it is that, it's not matter that much if it is 10 or 9, but if it is 6 or 4 in some patients, it may cause other complications. So anyway, we are going to remove only 20 to 30 or 40, 50 ml, 20 to 30 ml of blood. But still, if the HB is too less, that may cause the complication. So hemoglobin level should be checked. The screening for HIV, HbSAg and HCV is mandatory as we are dealing with the blood. So this testing are must before the Jalokavacharana. The patient should be free from any infectious disease. A new leech must be used for each individual. We keep the leech of every individual in different containers. After each use, leeches should be disposed by immersing them in turmeric infused water, so that we do the purification of Jaloka after Vamana. Coming to the main procedure. On the 5th day, after doing Snehapana for 3 days, Abhyanga on the 4th day, and the 5th day, the patient has to pass stool and urine natural urges, make them sit comfortably in Sukhasana. Like he should be comfortable. He can lie down, he can sit comfortably with pillow. Only he has to expose the part where we have to put Jaloka. Clean the area where the leech is to be applied using dry method, because many times if patient take bath prior to Jaloka, or if you apply any powder or cream, the Jaloka will not stick to the skin. So that is what we have to prepare with the dry thing. No soap, no oil, as a strong smell can prevent the leech from the sucking the blood. So they will not suck the blood. Hold the leech gently between the thumb and index finger and hold its mouth on the targeted skin area. Once the leech started sucking, cover its body with moist cotton to keep it comfortable. So they feel like we are in the water, so they continue the sucking. If the leech does not attach the desired site, we usually prick with the sterile needle to induce slight bleeding, or sometimes in the kids we prick for their mothers and then we put the drop on the area where we want to put the Jaloka. And then Jaloka, once she smells the blood, she starts sucking, or she just attached to the skin. Leech observation of the Jaloka. Dushta raktam raktapagamat shvayathu shaitilyam daha raga shulopamascha. So during blood sucking, the leech swells from the middle as it gradually draws blood. Rhythmic wave movement can be seen on its back while feeding. Once the leech has consumed enough blood, it naturally detaches from the site. If enough bloodletting has occurred, apply turmeric on the leech mouth, makes it detach immediately. That you have any choice, like you can stop or you can keep it. So once, usually after when she feels like satiety for the leech, she stop the sucking and she leave the skin. If sometimes the patient feels like it is more than 2.5 hours, sometimes it take time also. 2.5 hours, patient get irritated, or patient get like unable to sit in the comfortable position, so you can remove it also. So this is what in picture you can see, like this is what we have just applied, and then she started sucking, she's become more. This is just for picture. I remove the cotton cloth. Actually this is covered with the cotton cloth, with wet cotton. So this is what in last picture you can see, like yeah, in this picture you can see how this is after sucking the blood. This is just before she leave the skin. Here the picture has click lines. You can see the wavelength, like waves also of the blood. So this is what once she attached, so you can see the attachment, how this mouth is like it is a shape of you can say it's how she take bite, it is like this. And in second picture you can see there are 3 jalokas. So first one is just started the sucking, second one is more than that, she sucked more blood. And in the third picture, this is the last one, is on the third side, like second one when she stopped, we removed, and this is third one, she was till last she was sucking the blood and she become the bigger one. So this is what the observation you have to do in the Jaloka Charana. So post application of observation is, if it is proper application, the bite site shows relief from the burning sensation and pain. And the patient monitoring after leech attachment, check if the patient experience itching or burning at the site. If it is like Savi Jaloka, there will be the itching and burning at the site of the leech application. If it is Nirvi Jaloka, there will not be burning or any itching. So the post procedure which is mentioned in Acharya Sushruta, Shonitasya Yoga Ayoga Anveksha Shatadhota Ghutabhyanga. So Shatadhota Abhyanga is mentioned. Tat Pichudharanam va Jaloko Vranat Madhuna Avaghatayet Shitabhi Yadbhi Parishechayet Badnin va Kashaya Madhura Snigdha Shiteshi Pradehe Pradhiyati. So the wound care, what is mentioned after leech therapy, special care must be taken at the bite site, that is wound, as bleeding may continue for a while due to anticoagulant hirudin present in leech saliva. Previously I used to apply the anticoagulant on the site, but nowadays we keep the patient, okay, just wait till it stops by itself, because after Jaloka, when Jaloka left, the bleeding will be there for sometime for 15 minutes, for sometime for 20 minutes. So we wait for that also. And once it stops by itself, after the hirudin comes out, then we pack the wound. So we wait for that. Apply turmeric powder or a hemostatic powder after Raktamokshana dravya we used over the wound and cover it with the clean bandage. So what Sushruta says, Acharya Sushruta says, leech bite wound should be treated with hemostatic powder like turmeric followed by the clean bandaging. Proper care prevents bleeding and infection. What he says, if there is a Samyak Yoga, the like Abhyanga with Shatadhota Ghruta should be done. If it is insufficient Raktamokshana, rubbing or pressing with honey should be done. If it is Ati Yoga or excessive therapy, you can see, so application of cold like Shita Parisheka should be done. If it is Mithya Yoga or improper Raktamokshana or Jalokavacharana, use of astringent or sweet, that is Kashaya Madhura Dravya, should be there. So leech care after therapy, once the leech removed, place the leech in a kidney tray and sprinkle turmeric on its mouth. She start the vomiting. You just have to help her in the vomiting or in the removing the blood. Avoid excess pressure to prevent the injuries. Like the students who learn, the first thing they start doing with pressure. So that should be avoided. After vomiting, we put in the turmeric water to make her active. Or if any blood remains in the blood, she will vomit again. So if it remains inactive, it may have Indramada. So we will wait. Once she become active in the turmeric water, then we can see, okay, she can shift it to the bottle. The complications, if a poisonous leech or Savijalaka is applied, the bite site may show signs of swelling, itching and burning sensation. So, and there might be the systemic symptoms like fever, delirium and fainting may also occur. The treatments is Mahagada, like Vishachikitsa we have to do, Mahagada decoction, Haridra Khanda and Kaishorogugula for the managing complications caused by the infectious leeches. Coming to the second procedure, like in Ashastra Ashastra Raktamokshana, that is Shringavacharana. So Shringavacharana is the method of bloodletting using a cow horn, that is Go Shringa, as an instrument to draw the blood. The preparation is, we use the cow horn, is thoroughly cleaned inside and out. The inner part is hollowed out to create a cavity. The wide end of the horn is then placed firmly on the skin to perform bloodletting, that is Ashodhana. Main procedure is clean the affected area, make a small incision, that is Prachana, place the wide end of the horn over the incision and apply the pressure. Create suction by mouth using a cloth. Alternatively, use a pump or syringe for the vacuum suction. That can be also done. The post-op procedure is, after some time, remove the cow horn, clean the wound with Triphala Kashaya, dress the wound using honey, yashti madhu and turmeric. Nowadays, we are not using the Shringavacharana. This is what mentioned. That time there were not syringes or many cuppings were not available, so they were using the Shunga as a avacharana. Coming to the Alabu avacharana, bloodletting method using a cupping instrument called Alabu. Alabu is made of bottle guard. You can see in the picture, these are different shapes of Alabu are given. That is the collection and preparation of Alabu. Make a small hole at the mouth and remove the pulp. Hollow it completely and dry thoroughly. Use the dried Alabu for bloodletting. Material required is Alabu, gauze piece, scalpel or blade, cotton, yashti madhu, haridra and oil. This is the general pre-operative for all the Raktamokshanas. Like patient preparation, we should explain the benefits and possible complications in the patient's language before procedure and take informed consent with signature or thumb impression for documentation. The patient preparation is explain the patient. Routinely we do the check BT, CT, platelet count, pulse rate and blood pressure, and we prepare the patient for the bloodletting accordingly. Usually 30 to 50 ml of medicated ghee or oil internally we give for the 3 days. On the procedure day, we perform the full body abhyanga and swedana. The main procedure is on the 5th day after elimination or natural urges. Ask the patient to sit in the Sukhasana, make a small incision or prachana at the affected site. When bleeding starts, place an oil-soaked burning wick inside the Alabu. Place the mouth of Alabu over the incision, slightly tilted to avoid the burning wick touching the wound. As the wick burns out, oxygen is consumed, vacuum created. It creates a vacuum inside, and press Alabu firmly over the skin to draw blood by suction for effective bloodletting. So, post-operative of Alabu is, after 10 to 15 minutes, carefully remove the Alabu cup. Alabu or cup, nowadays we are using the cup. Okay. So, Ghati Yantra Ucharana. Ghati Yantra are small clay pots used similarly to Alabu for bloodletting. This procedure is comparable to modern cupping therapy. Indications of Ghati Yantra: blood disorders caused by Pitta dosha, and areas with blood clots, that is Rakta Ganti, there Ghati Yantra is applied. So, coming to the clinical applications of Raktamokshana, like for Jaloka Vacharana, for Sira Veda, this all the things I have just collectively giving the clinical applications. So, this is, you can see in the picture, like this is a picture of a Shwitra patient. As you see, the site is on the both legs, and here the patient, you can see like it is a very weak patient, so we cannot go for the direct Sira Veda, and as the whole doshas are located in the both lower limb, so we plan the Jaloka Vacharana in this, and you can see the changes after 2 settings of Jaloka Vacharana. You can see that there is the normal skin is started coming. So, this is what the effect of Jaloka Vacharana in Shwitra. Of course, after giving the small Virechana only we plan the Jaloka Vacharana. In all the Panchakarma, like when you will go with the all this course of Swayam online course on Panchakarma, you will find like in every lecture or in every module we have explained the effect of each Panchakarma. But collectively, when it comes to the clinical practice, not only Jalauka, not only Vamana, not only Virechana is effective in all the diseases. Collectively, whole treatment is effective. So you can see the in Jalauka, this is the indication of Jalauka after Shodhana. So you can see the changes in skin. So this is a boy of the 10-year boy. As he is a 10-year boy, we cannot go for the Raktamokshana with Sira Vedha, or we cannot go for the Virechana also. So we did just mild Vamana, and then you can see the before treatment how it was, and after treatment how this Shwitra is coming down. And now also this patient is in follow-up now also. So after that also he get this is whole normal coloration. Okay, this is the 12 years girl with vitiligo. The area is only on the back, so we can see like as we know this is only area, so the indication is only Jalauka as the girl age is 12 year and this pathology is only at this area. So not to why to go for the Raktamokshana or Siraveda. This only applying the Jalauka with some Krumi like Krumihar Chikitsa and some Nitya Shodhana. We can go for the Jalauka Vacharana. This is the boy with Indralupta. As you can see, this is the Indralupta. This is, as you know, is because of the Raktaj Krumi, this disease is happening. And if you give anything inside, it is not going to give any effect. So local treatment is more important in this. So like Prachana, if the patient is having strong willpower or Sattva is better. Otherwise, we can go for the Jalauka Vachana. That gives the better result. Coming to the Shwitra, this is actually the second sitting picture you can see. It was the whole white discoloration was there in this patient. We did first Prachana. Okay, so you can see how the Prachana is been done. And this is the picture after Prachana. You can see the change in the discoloration or white discoloration in the patient. Eczema, this is actually after Shodhana. Previously it was the lesion were like eczema. You can see the chronic case of eczema. That was the boy. He was also taking some masala. He's used to take some addiction. He was having some addiction, and that he was taking in the large dose. So he get the eczema in the both hands and legs. And this is what after Raktamokshana. This picture is of after Raktamokshana. This is just indication of Jalauka, clinical indication of Raktamokshana we are seeing. This is also this site was totally white before Jalauka Vacharana. This you are saying it's a after Jalauka Vacharana. It's the Switra patient. Here we cannot go for the Raktamokshana, here like Siraveda, or here we cannot go for the Prachana. So this area is just for the Jalauka Vacharana. This is again a case of psoriasis, a boy, which we did the first Virechana. This is the lesion. You can find how this plaques were present, and after Virechana and after Siraveda, you can see the change in the plaques. There now it's here the plaques are absent. So this is the effect of Raktamokshana. So what we learned today in today's lecture, we have discussed about the procedure of leech therapy, procedure of Alabhu-Acharana, and procedure of Shunga-Acharana with the clinical application of Raktamokshana in the various patients of psoriasis, eczema, Shwitra. So this is what the clinical application of Raktamokshana. Hope, dear students, you learn many things in today's lecture. Thank you for listening carefully. Namaste.